Welcome to Living the Reiki Life podcast. Hi, I'm Amanda.
And I'm Christy, and we're coming at you from the Prairie Province of Saskatchewan, Canada.
We met in the corporate world over a decade ago and became great friends. We started our Reiki journey together, and now we are Reiki masters. Follow along as we navigate life living the spiritual world while still working the 9 to 5.
We gather twice a month to chat all about Reiki and our Reiki journeys, energy healing, and other healing modalities.
We are going to interview some of our gurus and cover a vast majority of topics that we find interesting, and hopefully you do too. Let's get at it.
1, 2, 3, 4.
All right. Hey, everyone. Welcome in. It is Amanda and Christy here, and we are in mid-October. And while we record this intro, we're just above that. So we are in the month of October right now, and we just passed the full moon in Aries. And Christy and I both really felt that full moon energy. I don't know about anyone else out there, but that Aries fire really hit home for me all week. And I was raging. I was raging, and then I got sad. The fire. And then the emotion came after. So funny. But yeah, I raged for good 4 days. I'm ready to pick the battles. I felt like that Braveheart character with my sign, just I'm gonna hunt for freedom. I think I sent you that meme. And then it was Friday, Saturday, Sunday. I was really feeling that grief of the collective, especially in Canada here, because we were having our Truth and Reconciliation Day. And yeah, just that anger turned to grief real fast. And how about you, Christy? It was really good to text you to be
Yes.
this is what's going on, and have that connection and that circle. So nice.
I know. I really appreciate that. Just having someone to bounce it off with, hey, I'm not feeling right today. What is going on? And there was a lot of lead up to the full moon. It was 4 days before the full moon. I already noticed I wasn't sleeping good. And then I think it was the second night before the full moon. That's when a spirit came in and was bugging me when I was sleeping. And he wasn't a very nice spirit. And it was so bizarre because I had my eyes closed, just falling asleep, and I would see him in my mind's eye standing beside my bed. And then I'd open my eyes and he wasn't there. And it just, it freaked me out because I was hey, he must be standing there, but I can't see him with my naked eye. And I was just I don't want to deal with this. Please go away. Please go away. And I didn't like the feel of his energy. I did not like that at all. So I was just please go, please leave. And he did eventually leave, but I was up every hour that night, and I did not sleep well at all. And then I get angry because I'm not sleeping. And the next day it was a long day at work, but thank God for coffee.
Yeah, absolutely. I know it's rude. You're not allowed to come into my bedroom. I have boundaries that you're not respecting.
Yeah.
GTFO.
Yeah. I know. I was how did you even get in here? I was I don't even want to have a conversation with you. I don't know. I feel he's been hanging around for a while. I sense him standing outside, looking in the window. Because there's this one window I walk by, when I come upstairs, and I've been shutting it because I don't know. I just feel he's staring in there.
You should.
Yeah. I just go away.
I just feel there's this nerd kid outside just tapping on the glass.
Yeah. Help me.
But not. Yeah.
And I just shut the blinds.
Yeah. Totally. It's ooh, not the wind.
No, and it's funny, I think about, so I hate doing dishes, and we don't have a dishwasher here right now. So I've been really intentional about doing the dishes because I used to leave them at nighttime.
Oh,
I left them till the next day, and you wake up and that was the first thing I saw. So when at the end of the day, when I wash the dishes, it's I'm washing away my day and I'm putting everything away. So I have a fresh start to the next day. So I don't let things pile up. because I'm no one to do that. So I feel like these spirits in my house, I need to start dealing with them because they're the dishes piling up. And then before you know it,
Interesting.
I'm going to have a freaking messy kitchen and I'm not even going to know where to start. So
Yeah, then you're in super overwhelm.
yep.
And like we're in October. We're in the thin veil month here.
Oh yeah.
So it's just
definitely
like if you're
feeling
gonna
that.
get bothered, yeah.
Yeah.
Oh.
But it's like, do I sit there and like sit with them and like see what they need? Or do I just like call in Archangel Michael and try to get them just to leave? It's like, I don't know. It's like, how much time do I want to like invest in this and energy? Like, it's so important to keep your house clear, like in the work that we do, but it's just, yeah, I don't know. Kind of lost. Honestly.
I guess it's really what you want to do. Do
Yeah.
you have the time and energy right now? How are you feeling to sit with this and do it? If you don't have the time, you don't have the energy, then yeah, call in Archangel Michael to blast that white light and just like have a fresh start here.
Yeah.
You know, get the salt out too and start salting around the edges and especially your bedroom door, maybe.
Yeah, that's a good point. And I should get my tuning fork out too. Just kind of clear the energy, and especially after that full moon and like a lot of emotions coming up. Like even some inner child stuff even came up for me. Like when I was 10 years old, I was getting triggered at like certain things. And then I started thinking about this time in my life where I was sick, and I was just like thinking about like the way mom took care of me. Like I went down this huge rabbit hole, but it obviously came up to be healed. And
Totally.
yeah, I just released so much with that full moon.
Wow.
Yeah,
That's so good.
it
Amazing.
was good. Not fun, but good.
No, but it's not though, but you have to do it. Like you think about how much you released. So how much you are storing in your body. So those people who don't get the cry or don't get to scream it out, like they're just like boiling that in their bellies, and that's how they get, allergens and sore throats, and yeah, it's so healthy.
Yeah, they're piling up those dishes. Like if you think of this dish, like this was a really old dusty one in the corner of the cupboard that I just found that I forgot about. But we wipe it clean and we set it back there, and
Totally.
yeah, it's just, I guess, part of the journey. But sometimes it's a lot, and you don't really have a choice to deal with things at the full moon. Like I feel like it's there and you need to release it now, or it's going to circle back and it's going to be worse. You're going to have way more dishes to clean.
Yeah. I think too, it's really important now you honor the rest period that has to come with a release like that.
Yeah.
It's like you did the hard work and now you have to rest. You earned it.
Yeah,
and
that's
look
right.
at it as like a celebration to rest, not a bad thing.
Yeah, just hang out and take it easy. Yeah.
Yeah. That's really important.
Damn full moons.
So, yeah. Yeah. And you did a full moon circle ritual with Bree, who we interviewed for the podcast, and we're going to have her on. So that'll be good. Good for our listeners to hear. And if they want to partake with that next time too, to help like do the full moon thing, to help them kind of have that same release if they need it.
Yeah. And it's so fun to meet in community, and you can share about like what's coming up, or you can just like listen to others. And she guided us through a meditation, and she pulled some cards and explained the astrology. And it was just like, yeah, it was really good. I really enjoyed it.
Yeah. Yeah, absolutely. And so for this episode, everyone, we interviewed a guest that I met when I was pregnant, and her name is Amanda, and she is like a jack of all trades. So her biggest specialty would be reflexology. So super interesting how we learned about like the feet and how they're connected to all the sensors in our body. We talk about her being a doula, her Reiki journey, which was fascinating. I love hearing about people's Reiki journeys. This episode is just chock full of all things, and you're going to get a lot out of it. And so we're super excited for you to listen to it. So we're not really going to like fill up this intro with all of our stuff, but we did want to touch on that full moon because it was pretty, it was fierce this time.
Yeah, I agree.
Yeah.
Well, I really enjoyed this conversation too. Like I walked away learning like so many new things, and I really hope you guys learn a lot too.
Yeah, especially with that tea leaves, right?
Yes, and
Really?
the Astro dice, like I've never even
Yeah.
heard of that before.
Yeah, I've seen people
Super
read that
cool.
before. So yeah, stay tuned to the end because she reads cards and astro dice.
Yeah.
Super neat. Also too, getting ready for Halloween here. I was thinking more too about like honoring the Day of the Dead on Halloween, which is definitely more of a tradition than like Mexico. And I'm going to do that this year. I decided I'm going to put out an altar and just honor my past loved ones. It's more of how I'm going to celebrate Halloween this year, I think. And I'll give an update on how that goes.
Yeah, I really love that. I feel I'm going to be intentional about that day as well. And it's interesting, actually, my grandmas have already come to me during meditation. And my one
Yes.
grandma, she gave me like a super like message that just hit me in the heart, you know? And if you can set the intention to like sit with your ancestors like, or like your loved ones and just like see if there's any messages or just pay attention to little things around you. Like if the lights flicker or you see 1111, like, you know, like the little things that our loved ones send us to show that they're there and that they are okay. It's just like the perfect day to do that.
Yeah. And you know what? So it's been raining here for like 3 days in a row, like really good, steady rain.
Mm-hmm.
And today, me and my boyfriend, we were driving out to go for breakfast. And all of a sudden, there was this little ladybug in his Land Cruiser. And I was like, oh my gosh, like, where did this little ladybug come from? It was just,
Yeah.
I took it as such a sign. It's like, it's been just the dumpiest weather, and this little ladybug just
Aw.
been hiding out in the cruiser. And I was like, oh, I wonder who this is. And he's like, you stay there. Like, we're not
Aw.
swatting you away. So you're taking the ride with us. Yeah.
Yep, you
Yeah.
can
So
live in
funny.
here.
Yeah, it's
Aw.
great.
I
Todd
love
won't kill any
ladybugs.
bugs. Yeah.
No,
We'll
Troy won't either.
transplant. No. If a
No.
spider's in the house, he'll put it in a cup and move it outside. Like
Yep. I do the
the
same
only,
too.
yeah, only thing that doesn't stand a chance are mosquitoes. Get
Oh,
out.
I know. They're
Yeah,
tough.
it's an
Yeah.
active war on us. Get out of
Yeah.
the house. Yeah. But anyways, yes, so we will get into the episode and enjoy. Okay, so today we have a really special guest with us that we're very excited to interview. So I met Amanda back in 2022 when I was pregnant with my son. I inquired about getting my placenta encapsulated, and I found Amanda online. So Amanda has a very full resume. Not only is she a doula working with mothers and babies, but she is also a Reiki practitioner, and she works to safely and professionally provide placenta encapsulations as well. Amanda is also a herbalist and practices reflexology. I can attest to Amanda's amazing skill of reflexology as she took care of me while I was pregnant and then postpartum as well when I really needed her. She also has treated my father and Todd, who would also share in my excitement about her skills. But we are not done. Amanda also reads birth charts, teaches astral therapy, reads astral tea leaves and astral dice. She's also a mother on top of it, literally doing it all. If you want to know yourself better and really dive into some deep questions of where am I going and what paths should I take, you are really going to want to stick around for this episode and connect in with Amanda afterwards. We will make sure to leave you with all of her contact information and websites in our show notes. So without further ado, we'd like to welcome Amanda to the pod. Thank you so much for being here.
Thanks for having me.
Awesome. So we thought we would start, of course, with how did you get into Reiki and how did it find you?
Yes, that's a good question. So I grew up fairly religious. And at one point, when I was about 14, I kind of transitioned from more of that religious belief system to more the spirituality, self-help sort of genre, and discovered some books and yeah, really grew an interest. And I think I was, I would have been maybe grade 9 or 10, and I went into a crystal shop. Of course, this is standard, there's got to be Reiki in there. And it was Atlantis 2000. I don't know if you guys have been there, but it's in the Drenkel building in Saskatoon.
Yes.
It still exists.
Hmm.
And I met the man there. I don't remember his name or anything. And I think I had maybe gotten a reading from him, and I had a Reiki session or two from him. And I remember just not really feeling anything with Reiki, but I still had an intrigue and interest. So it never really left my mind, but I didn't pursue it so much then. But when I was in grade 11, I had taken part in an exchange program, a French exchange program with a girl from Quebec. So she came and lived with me for 3 months in Saskatoon, and then I went and lived with her for 3 months in Quebec. And yeah, it's interesting how I ended up falling, into the path of this girl too, because she had a lot of gifts herself. She was a very sensitive, energetic person. And when I was in the second half of my exchange, I was living in Quebec in a very small town called Saint-Angèle-de-Laval. And I was about to turn 17, and I was looking for a Reiki practitioner. And I had seen that there was a notice on one of the business boards of a local, Reiki master. And so I called and asked to meet with this person so that I could get all of her credentials. And I actually sat this woman down, this poor woman. I sat her down and I asked for all of her credentials and asked where she studied. And I needed to know that she was going to be good at what she did. It was an interesting sit down, because remember, this is all in French, and French is my second language. I understand it really well, but I don't always express it as eloquently. So my exchange student came with me. We sat down, we had this interview with this woman. And at the end of the interview, she said, I think you'd be really good at Reiki, and I'd like to teach you. So again, I only had 3 months that I was there. So this woman taught my exchange student and I both. This was free of charge, by the way. This woman was actually just like, I want to teach you guys Reiki. And we studied it together. And then we had a built-in exchange because we were able to provide Reiki to each other every night. And again, Carolyn was her name. She was very sensitive emotionally. And at the time I was very shut off emotionally just from my upbringing. I had really disconnected from myself emotionally. And so the attunements that happened had very strong healing crises both times. Those first two, I can remember being in my room at my exchange house and just waking up screaming and crying. And I remember both times I screamed and cried so hard that I bursted blood vessels under my eyes and in my throat. So luckily I was in a family that was very understanding. The husband, so it was a husband and wife, and they had 2 kids that I was staying with. The husband was a reflexology therapist as well. So I had an introduction to reflexology there. And believe it or not, I didn't like reflexology. But with Reiki, I had my attunements, and they were just very understanding of what I was going through. But I had massive breakdowns. And then since that time, my whole world opened up emotionally, and I was able to feel so much more. Carolyn was really interesting too, because she could see colors. And she was very connected to plants and animals, and she was always just crying, and she's so sensitive. And she always she could tell how I was feeling all the time. And she really helped me develop my skills, because what I realized was that she could see colors, but I could feel the colors. So we'd be able to, experiment. And say there was somebody walked into a room, and what energy did they throw off? I could guess the color, and I was always in line with the color that she saw. So it was interesting that we were both picking up on similar vibrations, but I was interpreting it in a different way. So yeah, so I learned a lot about just how I interpreted energy, and became a lot more connected to myself emotionally. And I went back every year to Quebec after that point, and I got my next 2 levels. So it was 4 levels in total. And yeah, I was the girl in grade 11 and 12 who was giving Reiki to my peers in high school. I remember, a lot of people were dealing with depression, or depression was probably the main thing, stress and depression. I bought a massage table. That was my first major purchase when I was 17, and had a Reiki room in my mom's house. And yeah, it really found me, and I never really stopped. I had a couple clinics in Saskatoon that there was one clinic that I was going to start at, but I had a run in with a Reiki master who didn't think that my Reiki training was good enough, which I thought was really interesting. That was my first introduction to the industry being as ego driven as any industry. You're going to have egos and that you come against, and people practicing in ways that you wouldn't. And that's true. That's true for every industry. But I learned it very young, and I remember crying about it almost immediately. I was like, this feels so wrong. I was like, wow, the way that she's treating me right now is wrong. And so I never ended up practicing there, even though the owners of the clinic really wanted me to be there. It was complicated because this woman would give a treatment to a specific lady, she was one of the owners of the clinic. And when she gave Reiki, the lady always shook throughout the treatment. She would her whole body would shake. And when I gave this same lady a treatment, she didn't shake at all. So, and who knows why? I don't know why she didn't shake, but because it was different, it was construed as wrong, or, I suddenly, even though we trained in the same method, I suddenly was in the wrong, and she wanted me to retrain all my levels under her. And I was like, oh my God, it was too much. So I ended up not practicing in Saskatoon at that time, which was a good thing. I moved to Calgary, and I pursued astrology instead. I studied astrology with a professional astrologer out there. And I ended up getting fairly ill. I developed an autoimmune condition. I think I'd had it all throughout my teen years, but I had Graves' disease, which was very hereditary. My dad had it, and most of my aunts had it, and another cousin of mine who's close to my age has it too. And it forced me to get back to various practitioners, and I always had tended towards going to herbalists, just because my mom was a lot more naturally focused. And so I went to an herbalist in Saskatoon who did, Reiki and reflexology and herbology. And she asked to see my feet. And I said no, because at that point I really didn't like reflexology. And, but she insisted, and she gave me a treatment, and it was really good. It ended up launching me into a completely different industry, a different program. And because I was living in Calgary at the time, even though I was visiting Saskatoon, I met that woman here. I pursued a holistic therapy diploma program where I studied all sorts of body works, not just Reiki, but reflexology, hot stone massage, aromatherapy. So all the relaxation massage modalities, along with, studying traditional Chinese medicine, Ayurveda. And then I continued into a few other diploma programs with, practical herbology and master, and clinical herbology finally. And, kind of started learning about my illness and trying to find a balance and trying to find health while I was also studying. And I eventually moved to Quebec for 6 months to do nothing at all. So I quit the job I was working in Calgary, moved all the way there, and that's where I did my Reiki master training. And by the end of that 6 months, my condition had stabilized, and I never had to be on medication or anything. And I'm the only one in my family who can say that. So it's been a long health journey, but it's been good. And a lot of it has been about just managing stress, and Reiki and therapies have been a big part of that. But yeah, I've met a lot of great people along the way. I had Reiki Circle in Calgary where I met some lovely women who did Reiki, but also astrology and tarot. And I'm still really good friends with one of them. There was another woman in that Reiki circle who was a reflexology therapist in Calgary. And she's since passed, but she was a big reason that I even looked at reflexology at all, along with that one herbalist woman, who gave a good treatment. And then this woman, I remember during one of the Reiki circles, I was at the person who was lying down. I was at their feet. And I remember just not wanting to be at the person's feet. Like I just hated feet. I had a huge aversion to feet. And I thought that all the negative energy was coming from the feet. And I remember she looked at me and she's like stopped me and she said, "There's nothing wrong with feet. Like there's nothing wrong with feet. Like that I should be honoring feet a lot more." And yeah, that really impacted my journey quite a bit, because I started to actually realize that how I was seeing this woman's feet was a projection about how I was feeling about my own feet. And because I was having some foot issues at the time too. And yeah, so I never thought I'd be doing a lot of reflexology, but I ended up somehow having that be my main bread and butter of my business. So yeah, so Reiki's taking me all over the place. It's the core of a lot of what I do. And I mean, all the therapies I've studied, Reiki is really at the heart of them. And I don't necessarily, I do treat people with Reiki every week, maybe not every day, but I don't open up with Reiki unless somebody's specifically calling to book me with Reiki, but I don't advertise it. I prefer to start with reflexology just because it's a good way to get to know a person first, and it's more tactile, and people can be logical about reflexology, whereas Reiki could spook some people off at the start. But I still learn a lot about a person just with a Reiki treatment, a quiet Reiki treatment. It's just not as conversational as reflexology. So once people get to know me, then we might start talking about other therapies that could work, like body talk or Reiki, and then we go from there. But I had written a bunch of stuff down, and now I don't know, I just went off there. So you guys reel me back in.
No, that's so good. No, that's so amazing. That's such a great story. And I actually have a couple questions about it,
Sure.
if you don't mind.
Yeah.
What kind of Reiki did you take? Was it
Like, yeah, the Usui. Yep.
Okay, Usui.
Yeah.
Okay.
Yeah.
I think we were saying it wrong, Christy.
Well,
You're the second person who's pronounced it like that.
French. Yeah, I studied it in French, so who knows if I'm pronouncing it the official way.
Oh, I love that. You also mentioned that you had 4 levels of Reiki that way.
Yeah.
Was that 4 levels and then your master's?
No, the 4th level was the master. So the first level was Reiki on a person. Second level was distance Reiki, which I also had a built-in exchange partner with that too, because by the time I left Quebec, I was able to do, exchange distance Reiki. So that was really neat. And then the 3rd level is a teaching level. So you could teach level 1 and level 2, but you couldn't teach the Reiki master level. So that was just the way that she had been trained. She also had, again, I studied in French, and she was also like a very Catholic woman. So a lot of the prompts that we had to memorize, would mention God. And, so everybody has a little bit of their own version of what they're training, but it was 4 levels that I did over, between 2007 and 2010. Yeah, because I did those first 2 levels pretty close together, closer than you would want to, but it was just because we didn't have much time in Quebec.
Right. And that all makes sense. Like when I was reading your website and I was like, you've been studying astrology for 20 years. I was like, Amanda, how old is this?
Yeah.
How old is she?
Okay. Well,
Yeah.
astrology, I've been studying personally since I was 10, believe it or not. Yeah.
Oh, 10.
I
Okay,
was
that
10.
makes sense.
Yeah, you can age me now. Now you can figure out
No.
my
Oh,
age.
no.
Yeah. But I started astrology first. I remember birthdays of kids in elementary school. It's not, I'm always researching and studying people. So people that are coming in, if I know their birthday, I'm studying them when they're here.
I do that too.
It's not just from books. It's all, it's very, watching, looking for the patterns and everything, but it's just for fun. I don't hold people to their signs or anything. It's just a way to have a conversation. It's just another way to connect to people. And I think that's the basis of who I am. I'm always trying to find ways that I can connect to people, and therapies, reflexology and Reiki, they're all great ways to connect to people. And it helps put people at ease at the same time while you're trying to get to know them. And I love giving hugs too. That's also how I like to connect with people. Foot rubs and hugs. If I was known at parties. Like I probably wouldn't drink at a party, but I'd get you into a conversation. I'd probably give you a good hug, and I might rub your feet. It's the kind of weird thing. I've been in too many situations where people are like crying in a bathroom with me and needing care. I'm like, just let me rub your feet. It's okay. Yeah.
Oh, that's funny. Christy can relate. People see her and they open up. I find actually I get that a lot too. All of a sudden you're just having this deep conversation, but those are my favorite kind to have. I don't want to talk about the weather. Like,
No,
that's just, I'm glazing over. Like
exactly. Exactly.
Can I ask you another personal question? And you don't really have to get too much into this, but when you had each of your attunements, you had like a big unravel inside of you. Did that happen during the attunement as well? Or was it something that was kind of after it sat with you and you went home later and you were sleeping, then it finally really...
Yeah, it was within a couple days.
It was a couple
both
days.
times. Mm-hmm.
Okay. So did you notice anything right away or no?
No.
Okay.
Mm-mm. No, I might have felt a little weird during the actual ceremony, but no, it was after. And the 3rd and 4th attunements that I had, I didn't feel anything. So those first 2 obviously they just cleared a lot of stuff. I think both can be normal for people. Some people can have healing crises that are extreme, and some could have nothing at all, and both are perfectly normal.
Yeah, you just
definitely.
You don't know what to expect, really, because I've heard so many stories of like nothing and then like on the other end of the scale. So it's kind of like you just got to go for it, I think.
Well, and I was also a teenager, right?
Yeah.
So that's another aspect, because I didn't have full understanding of what I had just gone through the first 17 years of my life. I didn't have time to process it. I didn't. And so it forced me into a bit more of an uncomfortable territory, I think, those first couple of attunements. But I just remember the broken blood vessels. Like it was the hardest. I think maybe one other time in my life I've broken blood vessels from crying so hard.
That's intense. And you were like away from your family too, like a long ways away.
Yeah.
Like, I can't believe that.
Mm-hmm.
Yeah, I think about the attunement and how it's just like, well, this could, it's like what you said in a Reiki session. It's like, well, you don't know if anything's happening, but you trust and you know that it's happening, right? And I feel like that's the same as the attunement, right? It's just like, well, no, it's happening. And people are like, well, why do I really need an attunement? Like, what's really going on? It's like, it's real. Like, it's so
Mm-hmm.
real.
Mm-hmm.
And
Yeah,
that is
and
exactly.
it's just a big trust game. I had to do attunements virtually. That was interesting. I did a couple during COVID, and you can do it. You really have to be concentrated, but you just have to trust, and they do work. But what I don't do distant. I don't want to anyway. I don't do it anymore. Distance Reiki training, because what I found is that the students just have a harder time following through when you're teaching something that's so touch based. It's hard for them to just start doing it. So you really need to be in person. You really need to do that practice just so that people are getting used to touching people, because I feel like it just was not successful doing it online. The attunement was fine. Everything worked. And when I did see them in person, the Reiki felt like it was flowing fine. It's just that they couldn't seem to take it to that next step of practice. So it's personally just not something I want to do again. I like in-person training.
Yeah, we did both for our training, and I did enjoy the in person more actually. Like I always love being in person. It just feels like more of an experience. Doesn't mean it's like less effective. Well, like because I do a lot of distance Reiki sessions, but for the teaching part, yeah, I did feel like it was really beneficial to be in person.
At least for the first level. Maybe like with the next levels, I think you could get away with it. But for both of these people, they were brand new to Reiki, and it's just not the way that I would want to do it. And distance Reiki is awesome. A lot of the time, doing distance Reiki in a session is more intense for me than in person. And I think it can be even more discombobulating because you're not as grounded. When you have that touch factor, you're just more centered and grounded.
Right.
But you can get a lot of messages, and you can gain a lot of understanding about what a person's going through at a distance. It's just, I leave those sessions just not feeling as grounded. So I like doing them. I'll do them, but they take more out of me than doing a session in person.
Interesting.
Yeah, that is. Yeah, in a way I like distance sessions because I feel like I can almost relax more. I don't know, but like I'm going to do a distance session tomorrow, and I'm actually going to have them on like headphones so that we can communicate, but we're not actually obviously looking at each other. And I feel like almost that's the best balance, to be honest. I really like that. Just gives me more freedom to just really open up and have them not just kind of awkwardly stare at me. Some people stare at you and not close their eyes.
Yeah,
not often, but
I'm sure it depends on how you do it. I guess I typically would have them lying down or something, and so we're not seeing each other. It's just where I go with them, because I really try and put myself in the room with them, and yeah, it's more disorienting. It works. It's just more disorienting, and I prefer touch. I'm such a touch-based person, and that's the majority of my practice is touch. So it's something I do, but it's not something I prefer.
Yeah, that makes sense. I remember I was doing one session and on Zoom, and I was like just expecting her like to lay down, and I was like, okay, are you gonna like find a comfortable spot and lie down? She's like, nope. She's like, I'm just going to sit here. And I was like, okay. So I expect her maybe to close her eyes, like to tune in or something. And I was like, no, she just stared at me the whole time. And the session it did go pretty well. Like I ended up closing my eyes just to create that barrier. But yeah, I don't know. Maybe she never had Reiki before, and then I remember practicing Reiki online, and the one girl was like eating a salad, and I was like, okay. I was like, can we be done here? I was like, this is not worth my time, but
right. Yeah.
You just learn as you go.
Yeah, I feel like there's certain standards and ethics that could be followed just to make it comfortable for everybody.
Yeah. Yeah. I definitely learned, like, what to say to someone when you prepare, like send off an email and just kind of explain how things work. And yeah, just a learning experience.
Mm-hmm.
Yeah.
Amanda, you talked about like being really big touch person. So that really does bring you into like reflexology. That fits really well then.
Mm-hmm. Yeah, there is something about reflexology that continues to intrigue me. And I'm giving touch and getting touch somehow. So it's
Oh,
it's
yeah.
just such a well-rounded practice for me. And I get cute aggression. Do you know what cute aggression is?
No.
When you
No.
like when you just like see a really cute puppy and you just like want to squeeze it kind of thing. Like I have three
Oh.
cute puppies. I just always want to squeeze them. I see it in my daughter too. She gets cute aggression. And you just like want to squeeze something. And I think I've had that forever. And so out of reflexology, it's like I can constantly sort of massage and the foot, and I'm almost like getting that, that cute aggression out of me on people's feet. And I mean, I enjoy giving massage too, in a similar way. And I'm still connected to a person because my main skill with Reiki is if I'm tuned into you, I feel you from the inside of me. So if I'm working on a person, I'm basically working certain areas until I feel it release, not only in the foot, but in me as well. It's like that anxiousness or that tension starts to dissipate. And so it's like I just work on the foot until I feel better as much as the foot feels more tender and relaxed, or supple, I should say. So yeah, it's a really fascinating therapy. So essentially, for people that don't know what reflexology is, it's the application. Yeah, it's the application.
I was going to ask you. Yeah.
It's primarily on the feet, but you also can massage hands and ears, and some people do facial reflexology as well. But I work primarily on the feet, and every point in the foot is a referral point back to another part of the body. So by pressing on these areas, it's helping to increase circulation, encourage tissue repair, and primarily it's helping to induce a rest and repair state in the body. So your right foot is reflective of the points on the right side of the body, and then the left foot is reflective of the points on the left side of the body. So I usually start with the right foot, and you'll notice as you go along when you're working on a patient that there'll be tense points. You might not be great at it right away if you are studying reflexology, but it's very subtle. It's like you're working on somebody's back. You're looking for little knots in a person's back, but that's on a much larger scale. It's the same with the foot. You're looking for these tense points, and the client may be able to communicate to you that there's a point that might be a little bit more tender. But usually I'm just looking for points that are tense, and I work them over and over again until they start to release. And you have points for everything from, your tailbone all the way up to your neck and inner organs, sinuses, everything. So it's a very satisfying treatment, and it also teaches you a lot about a person because it teaches you how and where that person is carrying stress and tension in their body. And everybody carries it a little bit differently. And so I find it intriguing. Some of the main things I've found that were very fascinating is when people, maybe don't have an organ, or, one was removed, or there's, pregnancy has always been really fascinating to me because suddenly there's a placenta. So now there's a point in the foot that's reflective of the placenta. And, even today there was a patient who only had one kidney. So, and only from birth had one kidney. So that was really interesting. Like, just like feeling the space where a kidney should be. It was just not there. It didn't feel like the typical reflexology point for an existing kidney, so, and in a lot of cases, when you have somebody who's had a a kidney transplant, they add the kidney. So it's a third kidney. So I've had patients with multiple, more than two kidneys before. And yeah, it's very fascinating. One of the more interesting cases I had that I can remember, and it still comes to mind once in a while, is there was a woman who came, and she had a really difficult labor and delivery. And from that, there was a triggering in her body of ulcerative colitis. So her body was experiencing ulcers in her large intestine. And we found the points in the reflective point for her large intestine. It was just a very sore little spot in her foot that we just kept working. And she had asked me to keep working on it, even though it was painful for her. And I did. And, I told her to go home, relax. And, she had a weekend without her child and husband. And I was like, great, just like go take the weekend, relax. And I found out a couple weeks later that she didn't end up taking the weekend because she ended up in the hospital. So I guess her ulcer had ruptured. So with reflexology, again, it's not like I'm working on her bowel, but I am connected. There's over 7,000 nerve endings in each of your feet, and your nerve endings are connected to everything. So we must have created enough circulation to impact that ulcer. So that ulcer had ruptured and it was drained. And when she came back, consecutive times, she was finally out of pain. So that was a really, it was a good, bad thing. It was like, oh, geez, I'm sorry. I had anything to do with you ending up hospitalized. This is the only case I've had where somebody's ended up hospitalized. This isn't a common thing, but I bring it up because I'm like, I didn't mean for that to happen. But in the end, it was a really good outcome for her because she had been in a lot of pain from this condition for, I think, the better part of a year from that point on. So, yeah, I mean, you can have very real results. How it works is not very understood. Like, it's an old therapy. It's over 5,000 years old. And there's a lot of texts and artifacts that date back to all sorts of different cultures that studied footwork. And it was passed down by oral tradition commonly or by traveling monks. And we ended up in the 20th century kind of developing reflexology a little bit more into what it looks like today. But it's just incredibly fascinating. And I've been able to use it in birth as well. And you can see the impact of working on the feet and watching the blood pressure it be impacted, so it's just a very fascinating therapy that's kept me intrigued. Reiki has kept me intrigued too, but reflexology kept me very intrigued because everybody's different and it is very reflected in the feet.
Amanda, can I ask you a question about that lady?
Sure.
So did you pick up that she had the ulcers, or did she tell you?
No,
you worked on it.
She was diagnosed with it. So
okay.
Now I had just found a point in her large intestine reflexology point, right? Because you have half the large intestine on the right foot and then the second half of the large intestine on the left foot. So I think it was on the left foot that I would have been working on. And I just, in that reflex point, there was some kind of little bump that was extremely painful for her. And we just kept working it until it didn't hurt anymore. And that was the outcome. And who knows, it could have all just been a huge coincidence and it was just on the, precipice of happening anyway. But yeah, I think that's what the whole point I was trying to bring up was, if a new organ or a new cyst or a new ulcer, anything that suddenly exists in your body comes up, there's all of a sudden a reflex point for that, or you can you can find a point. So that's what keeps me intrigued. I don't understand what it works. Nobody understands how or why we're designed this way. We just have theories. So why does reflexology work? It could be just the application of the pressure on the nervous system, right? All the nerves that are connected there. There's zone theories. So we have various zones in our body, and they all, have a ripple effect. When you're working on one zone of the foot, it can impact like the top of the head, the arm, and that entire length of zone area can be impacted. Or it could just be, how meaningful touch can impact the nervous system to a point where it goes into that relaxation parasympathetic nervous state and just helps to encourage the body to heal itself, which is really the fundamental purpose of Reiki as well. It's just it's not to heal others, it's to help the body heal itself. So it's very empowering for people, and it's very intriguing. And yeah, I didn't think reflexology would end up the therapy I ended up doing primarily, but it did. And I'm an examiner for the association. Like I do, I'm a very active member with the Reflexology Association. So I do, I do try to safeguard the quality of reflexology in the province. And I'm very in love with it.
Yeah.
Yeah.
Yeah, I can definitely tell. It's just like comes from your heart when you talk about it.
Yeah, and my hands just do what they need to do. It's similar to Reiki. Your hands just sort of do what it needs, hold the poses where they need to be held for as long as it needs to be held. And reflexology it moves through me in the same way. And I like helping people feel better. So it's a win-win for everybody.
Yeah. Oh, totally.
Yeah.
And I wanted to ask you about like when a point is really sore. Because I remember my mom took me for reflexology when I don't know, like maybe 10 years old. I had chronic nosebleeds, like insane nosebleeds. And the guy that was like the expert back in the day, he's passed now, but he was just such a gentleman. He was so good, but he was able to like tune in and say like, once I hit puberty that my vessels will like thicken and it would help with the nosebleeds, which I thought I didn't really fully understand that. My mom wasn't sure either, but that's exactly what happened. But when he was working on my feet, like there was points where I was in tears, and I was just like wondering what's happening at that point when there's so much pain.
Oh, for sure.
Was that an emotional release, Christy, or was it tears because it hurt?
Oh, it was like pain. Yeah.
Yeah.
Oh, it hurt that bad. Oh, okay.
Yeah.
I thought it was an emotional maybe cry.
Yeah. No.
Okay.
I have experience with that too, because I hated reflexology growing up because it was extremely painful.
Mm-hmm.
And it could be the practitioner going too deep. It could be. It could also be that young people deal with a lot of stress and a lot more than we give credit to, and typically when I'm working on a client who has a lot of tenderness in the feet, it could signify higher levels of inflammation in the body. So yeah, for me, in those years when everything would, be so painful that I was like sweating or crying, like that's too far. You never want to see that with a client. But yeah, it could have been just a lot of inflammation in your body that was there. So that was my experience anyway. So with kids, and anybody with like an active health condition, you do want to go lighter. So it could be that they were just going too deep. But I don't know, were you a stressed kid? Like, did you have a lot going on at the time?
Yeah, I did. Like I had like a traumatic birth, and I had various surgeries through childhood, and it's like a lot of that. had a play in it. And also I was dealing with, I had, my knees would swell up like balloons and they thought it was arthritis. So the doctor was just pumping me with more Motrin. Wasn't doing anything. And then I find out like when I'm 30, it was like a lymph node issue. Like my body wasn't draining properly. So I probably was inflamed quite a bit. Yeah. So that makes total sense.
Yeah. That's what I noticed on my young patients is that there's just so much stress there. Like there's a lot, people are going through a lot. And I guess that's some of my big red flags with reflexology is if somebody comes in and they look really, I have 2 red flags. If they look really cool, calm, and collected all the time, those are usually people that have enormous amounts of stress that show up in the feet because their body is pumping itself full of cortisol to allow for the appearance of them to look cool and calm and zen. And they tend to be the people, that take on everybody else's stress and because they look like they're a rock and like they can take on anything, yeah, those are big red flags for me. And if people don't close their eyes. So if I'm working on people's feet and their eyes are open the entire time, it's signaling to me that there is either hypervigilance or there's a difficulty switching off from your fight or flight busy brain response to that rest and repair mode. So sometimes it takes multiple treatments to get them there. But once they finally close their eyes, I'm like, there. Like we're getting somewhere. It just, everybody has different defense mechanisms, right, in place. So you kind of have to work with people where they're at. And it's not necessarily a bad thing. It's just, I have to work harder to get them there. But yeah, there's lots of really interesting things you can find through the feet.
Yeah. I think that our bodies like hold our trauma in them and it comes up in a physical form. So for you to find things like that in the feet, like 100%, I believe that. Yeah.
Well, yeah, people don't need to write it down on an intake form. I get a lot of the time. I mean, that happened yesterday again. It was like, there was no mention of any kind of, injury or impact injury. And then it's like, oh, you've had whiplash before. It seems like, like, it's like, oh, they're like, oh yeah, I was in a really bad car accident 7 years ago. I'm like, okay, well, those are things that would be good to put down. I mean, people don't have to, because your feet, they don't lie. Your body doesn't lie. That's one thing I really appreciate about this line of work is that, the mind and people might lie to you or lie to your face, but the body never lies. It's a very honest communication. If you're sensitive enough to the language of the body, you can pick up on it. And it just, the body's not a liar. So
yeah,
not at all.
No. And Amanda, when I went for my session, like my second session, I was postpartum and you helped with my milk flow because I was kind of having a tough time with breastfeeding at the time and my C-section scar. You definitely helped and you could feel the pain in my sacral. Oh yeah, gosh, you helped so much. And even Todd, like when he went, I'm pretty sure you picked up on his sobriety, I thought.
Yeah.
Is that something you would have?
I mean, it might come up in conversation. It's not necessarily something it's not necessarily something I pick up on in the feet. But what I do find about reflexology is it does put people at ease enough to communicate with me and to share with me. So I find, the body is telling me something through the feet. And then if we can get those defense mechanisms sort of deactivated, people start to share. And they tend to share pertinent information in regards to certain areas that I'm even working on. So it tends to be an overall communication that starts to happen. But first you have to get people feeling safe. So that's kind of that first step. But
he's a really open book. So I'm sure he would have just, I don't know, had a conversation. Or if something remotely came up, he would have just, no issue there. So I think that you doing reflexology and the fact that you are a doula would be an amazing asset to these pregnant moms. I know my feet swelled up to 3 times their size.
Oh, yeah. Yes.
And I couldn't imagine having somebody like you in my corner.
Mm-hmm.
When you are helping women.
I've worked on a lot of swollen feet. It's always fun to compare after you work on one foot. Like you can have full movement in one foot and the other foot like can't move at all due to the swelling. So it's kind of interesting. Yeah, I'm known to give a lot of reflexology in labor. That's how I know I can do reflexology for 12 hours straight. That's probably my the longest I've ever done reflexology, because if that's what is working for a woman, you just do it. You don't think about the time. You're just doing it.
Sorry, I don't want to interrupt your flow, but when they're pregnant like that, and let's say they're right at the end, can you connect into the baby when you're touching the feet? Have you been able to do that? Like maybe using your Reiki with the
Yeah,
reflexology? Can
more
you tap
so
into
with
gender or?
Reiki. Well,
Okay.
more so with Reiki and just for fun. I mean, I can guess
Yeah.
a gender, but I don't try to get anybody's hopes up too much. But yeah, I mean, connecting to the baby, it's more so about connecting to mom for me, I think, because the majority of my skills are about reducing stress in the mom. And that's really such an important component in helping labor be as effective as possible, and the hormones to be operating as much as possible. So my focus isn't so much on the baby. It's on getting mom feeling like she's at a place where she can deliver. And that can go through a lot of waves, you know, pre-labor and during labor and postpartum. There's physical contractions happening, but there's also a lot of mental contractions that are happening because, you know, you're given new information every 20 minutes, every 20 to 60 minutes about how you're progressing. And, you know, women have to go through a lot mentally in labor, just kind of navigating those waters. So I feel like I'm always supporting the progression of labor physically and mentally, just the same, and emotionally, you know. So yeah, it's very useful to have skills like Reiki in the birth room, because it helps you connect to mom very efficiently. And like I said, my method of sensing is I feel what they're feeling. So I don't have time to try and find the right spot I need to be pushing on. I need to know what it is. And Reiki has been such an effective tool for me in the birth room, because I can just find that spot right there and just hold it. And moms need relief and they need it now. You know, there's no messing around. So yeah, you have to have good stamina, but it's the world that makes the most sense to me, is the birth world, even though it hasn't always made the most sense at the time of my life that I was in, you know, depending on if I was pregnant myself, even though I only did one birth when I was pregnant. And, you know, when having a young baby too, it's harder to do births, but you can do it. It's just, I only did one when I was breastfeeding, and that was tough, because I think I didn't breastfeed for my boobs were just they were so swollen for my baby. I think she wasn't too young at the time, but it was tough. I was very relieved once I finally found my way back to her, but all the timing worked out perfectly, luckily. But yeah, birth it's a whole world, and it's very political too. And I'm not a very political person myself, but I do find myself getting very heated and political when it comes to birth. So it just feels like it's the right place for me to be.
Yeah. That just makes me feel so good that you're helping the mom and baby like come into this world like in a good environment, because that's so important. And I remember I was talking to my osteopath, and her passion is helping babies, because she's like, if someone like has an issue at birth and then they go through their whole life not dealing with it, she's like, why don't we help like the baby when it's like born? You know, like just set that baby up for like the best life. And I just feel like that's something that you're doing, and that's amazing.
Well, and a big part of setting that kid up for life too is making sure that mom is okay. I think my
Yes.
passion always goes back to mom. Like
Mom.
babies are like rubber a lot of the time. They seem to be able to bounce back, but they need a healthy, happy mom. And like motherhood can be extremely depressing. So we need to set moms up for success. And so my passion is I mean it's with babies, but it's more about moms and helping moms get through
Yes.
really difficult times because it's not easy times. And and moms do a lot. Women are incredible. I love working with women, but it's a big undertaking having a child and becoming a mom. So
You know, it definitely is. And I can attest to this since I'm a new mom, first time new mom. And just making sure mom is not stressed while she's carrying. I feel like just that energy going into the womb is a big one. And just really bringing back like spirituality into the birth again, not to get too political either, but maybe taking a little bit less of the medical practice out and just more of the natural. We've done this forever and just make it more of a beautiful, calm experience as it should be. Is just, I love that you offer that. That's just beautiful.
And I mean, birth is going to look the way it's going to look. That's one thing I've learned about birth. It never looks the way that you expect it to look, but it's all about empowering a mother while she's in labor, making sure that she's in charge of her decisions. Because as soon as a mom feels like decisions are happening for her and she's out of control, that's kind of the breeding ground for trauma in the birth world. And so for me, it's just about reducing trauma. Again, that's helping set up a mom for success as well as her newborn. And I think doulas are pretty essential. I mean, a good doula, I can't say that all doulas are the same, but somebody who cares about, if they're in it for the right reasons, I think they bring a really good support and a very essential support to the birth room.
Yeah, definitely. I agree. So just going with the birth and everything. So when I was pregnant, I reached out to Amanda because I wanted to get my placenta encapsulated. I heard, well, I actually consulted with my Reiki master about it because she practices like Ayurvedic, would that be the right word? Vedic medicines and things like that. She does acupuncture and is just really in tune with like ancient Chinese medicine and things like that. And I asked her if she thought it maybe would be a good idea. And she was like 100% yes. So then I reached out to you and you encapsulated my placenta. And to be honest with you, like for the amount of time that I bled after my C-section, which I thought was ridiculous, way longer than they had quoted me. I think it was almost 9 or 10 weeks. I swear that this is the only thing that one made me feel strong and made me mentally feel good because by the end of that time, I was feeling like I'm over this now. I just want my body to heal. I don't want to bleed anymore. What's going on? Is this normal? Like, but I swear that's one thing that just made me feel better. Can you like touch on the benefits or why people would maybe want to do this and kind of what it's about, maybe for people who don't know?
Yeah, absolutely. So there's some physical reasons why people might want to consume their placenta postpartum. There's also cultural reasons that people might consume their placenta, but essentially placenta, it's a temporary organ, right? That's expelled after birth. So while the placenta is in you, it's providing oxygen and nutrients and removing waste from baby's blood. So with placenta encapsulation, we're taking a placenta, a healthy placenta, I should say. Sometimes there's infected placentas, or placenta might have cancer, and those aren't recommended to encapsulate. But it's a way to reintroduce low levels of certain hormones that are still active in the placenta, as well as replenishing some iron stores due to loss of blood. And now iron, iron deficiency related anemia can have impact on mood disorders too. And so if you can keep your iron levels regulated, that's a big help, as well as introducing back some of the hormones. I mean, all mammals do consume their placentas postpartum, except for humans, except for certain cultures might. And camels don't consume their placenta, but every other mammal does. So we can assume that it's to, reintroduce iron from blood loss, those hormones to get a boost of energy, probably to lessen the detection of blood by predators and everything, to get rid of anything. But it can definitely give a boost. And there's a lot of anecdotal evidence with placenta encapsulation that's really positive, that it can help with lessening baby blues or postpartum depression, and it can help with energy levels, pain, healing, breast milk production as well. And we do have some studies, and we have some ongoing research that's going to be coming forward. It's unfortunate because the placenta placenta encapsulation has gotten a bad reputation. In a sense, we did have a case where the placenta was potentially not dehydrated adequately to an adequate temperature. And there was a baby who kept getting reoccurring infections from group B strep, which is a big concern during pregnancy typically. So this newborn kept getting reinfected, and they weren't sure why, because there wasn't any GBS found in the breast milk of the mother. But when they did test the placenta capsule, they did find it. So again, GBS, if the placenta is brought to a high enough temperature for long enough, there isn't a concern. But there's always the risk of somebody, not handling the placenta adequately. And it did seem like it was dehydrated from raw, whereas I always steam my placenta first and then dehydrate. So when they did test the placenta, they did find the same GBS. So that is always a risk, but that one story kind of, the media took it, and instead of investing more into understanding the placenta, it kind of tried to shut everything down. At that time, I know I had news, like the news trying to get in contact with me to talk to me. And it became really political, because it's not, we can't prove that it was the placenta, because it doesn't, it could have, GBS it can exist on your skin, right? So it could have been from somebody else who also had it and was touching the baby. But it is potentially the placenta that could have been, increasing the concentrations on the mother's own skin by taking it internally, which is a risk, right? So we don't want that. And you don't see it commonly within the industry, but that definitely caused the placenta to take a back seat for a lot of people, because if you Google placenta encapsulation, that's one of the first things that you'll see. And there was a lot of midwives who wrote rebuttals about it, about how great of a practice this is and how essential the practice it is. But it's not, if there's any natural health product that has even a shadow of a doubt, it gets really, gets shot down by the media. And we have more of that coming, not just with the placenta encapsulation industry, but we have a lot with the natural health product industry being under fire right now with some new laws that are being put into place. It's another whole political world. Again, I'm not a very political person, but there's a lot coming where, it's going to be harder and harder to have regulated supplements on the shelves. So it's sad in a way, because a placenta is very natural, and most of the time, if it's a healthy placenta and a healthy patient with no, you know, pre-existing conditions, it's no different than consuming, or if a well-prepared steak. It's treated exactly like a meat product, except that we are steaming and dehydrating and grinding it down, putting it in capsules and consuming over a short period of time. And it's one of the great natural things we can do for ourselves postpartum, and a lot of mammals partake. But yeah, I mean, the placenta has been researched and studied for decades, and enough that we know that there's enough active hormones in the placenta that it can be classified as a drug. So Health Canada has classified it as a drug. So it's potent. It's something that has an impact. And again, anecdotally, we have a lot of great feedback, and we do have some research that is positive. But with articles and media backlash like that, it's really hard to get proper funding to learn more and to discover more about something that's really natural. But the whole political side of it is, well, who's making money off of it? Like, if a pharmaceutical company maybe can't make money off of it, then there's no harm in shutting it down, So it's complicated. It's complicated.
Well,
yeah.
I just wanted to say, then there's some of those pharmaceuticals that you take, and the side effects on those are worse than like what you're even trying to treat. But it's like, let's push those through to the front of the line when it's like, what? I know, it's so silly, silly. I don't know. But yeah, I definitely agree with what you're saying here. 1000%.
Well, and down the road, it would not shock me that a company would try and replicate things that they currently can't make money off of, like breast milk or the placenta, or and somehow get it into a synthesized pill. Be like, well, this is what's that, so it's not a stretch to think that. I mean, there is a lot of money and funding going into researching things about the placenta, but it's not about just having the placenta encapsulated and eaten as such, right? So it's there's still a lot of intrigue with placenta, but it's just they don't want people preparing and consuming it themselves, even though that's kind of, I mean, we're mammals, right? So it's like, that's what we would do if we were still living by a natural code. But
eat the steak. Eat the placenta.
Yeah, exactly. I mean, there are some people who bury the placenta, or they there's the lotus birth, so they preserve the placenta and they wait until the umbilical cord falls off. There are cultural norms around the placenta, depending on where you're from. But yeah, it's a tricky subject to talk about, because I do think it is a great thing to do postpartum, but there are things to consider as well. And the media has definitely affected the momentum of placenta encapsulation, but it's still worth looking into, and a lot of midwives attest to that. So yeah.
And I think, like, with the generations coming up, like, I think they're more open-minded to this. I feel like it'll become more popular over time. Because, Amanda, I remember when you told one of our friends that was like maybe 15 years older than us, and she just like had the worst reaction. Like, couldn't believe that people do that. And I was like, where have you been? Like,
it's funny. I forgot about that.
Yeah. I think it's like a generational, like, as time goes on, I guess if the politics stay out of it too, but it'll be interesting to see, like, 10 years from now where it will be. I hope it's more common and more like more talked about. Like, and
Yeah.
you don't have to be scared to be like, hey, I'm taking my placenta, and like not be like shamed or judged or, like.
Well,
Oh my
and
God.
even with the health industry right now, like taking a lot of, or planning to take a lot of supplements off the shelf, 10 years from now, we might have a lot more limitations as to what we can take in terms of a natural herbal product, and even more limitations potentially with even taking your own like placenta, so
Right.
we might be a lot more restricted as to the choices we can make in Canada for what we want to introduce into our bodies. So I hope it's more open, and but there's huge fines coming right away that it could be putting a lot of manufacturers out of throwing them into bankruptcy. So I think we're actually more likely to go into more limiting waters as to the natural world, and unless there's changes to laws. So yeah, it's all very interesting. The whole world is interesting with the herbal natural health world.
Yeah.
Christy, going back to that generational thing. So I remember I was at my mom's and I was like, hey, do you guys have a cooler I can borrow? Just like a little one. And she's like, oh yeah, like what do you need it for? And I was like, I needed to bring my placenta home from the hospital. And she was like, what?
Yeah.
Like you're kidding. And I was like, no. Like yeah, it was pretty funny. I mean, obviously they lent me the cooler and they were
Oh, they
fine.
did?
But
Oh,
yeah, the
that's
reaction
good.
was so funny.
Mhm.
Yeah.
That's awesome.
Mm.
So we just found out that would you call yourself an astrologer? I should ask that before.
Yeah, it's interesting because I have many different hats, but so
Yeah, you do.
my clinical practice, I'm a doctor of natural medicine and reflexology therapist, and I do body work. So that's primarily what I'm doing throughout the day, but I've been studying astrology since I was 10, and I trained professionally out of high school, actually.
Oh, wow.
Yeah, and it's just always been the way that my brain works. And I don't know if it's just, I grew up with religion and a religious background typically prompts you to look for an answer, to life.
Right.
And maybe I wasn't getting good enough answers through my religion. And so I transitioned into astrology, and I felt like I maybe got more answers that way. And at this stage of my life, I feel like I'm really okay with not having any answers at all. So it's not necessarily something that I live by, but I do find it really intriguing and interesting. And I like to inspire just a playful sort of curiosity in people about astrology, and just so that they can see their own patterns themselves within themselves in their signs. So yeah, it's just something I do that's a little bit more fun. I don't introduce it to clients. I mean, my last client of the day today, she brought it up herself. She asked me what my birthday was, and I was like, oh, okay, well, what's your birthday? So that's actually happened a lot. So it's like I get to know a person, and then it might organically come up, but it's not something I present with. When I very first started my practice in Saskatoon back in 2011, I had a whole list of services that I provided, but and astrology was on that list, but I kind of whittled things down, and like now I promote reflexology, but then I also promote my 2-hour sessions, which are an integration of my hot stone and aromatherapy massages and reflexology, and sometimes Reiki and head massage, that kind of thing. So that's kind of like those are the two areas I sort of put I make public. And then astrology is sort of just a passion. It's always just been a passion. It's always been on my on my list of things that I enjoy the most. So yeah, I sit down with clients, I do birth charts. I also, and that's not listed on my website at all, but one thing I love writing poetry. And so I do write poetry based on your birth chart. So I can take your birth chart and write a poem about it. And I've done that for a lot of newborns. That's kind of been what I've been commissioned to do, because it's fun to like look at a baby's birth chart and write a poem about it. And
that would be a beautiful baby gift.
Yeah.
Oh my God.
Gift.
Yeah.
It's a very satisfying thing for me to do, because I love astrology. I love words, and looking at a birth chart, it's a language I understand. And yeah, so that's something I don't promote, but people know that I do it. So they just sort of reach out to me privately.
Amanda, what kind of astrology do you read? Is it the Western astrology or the Vedic astrology?
It's Western astrology. I came very close to studying Vedic astrology. It was between studying Western astrology in Calgary, or I had a place in India to go and study Vedic astrology right out of high school. And I chose Calgary in the end, but I was very close to studying Vedic astrology. And I still have plans to. I know there's a Vedic astrologer I have a connection with a Vedic astrologer in the city that I'll probably pursue soon enough. But yeah, so I do a few different things. I read birth charts. I typically do a little bit of tarot along with astro dice with people, which is part of astral therapy. Astro dice are 3 12-sided die. One dice has the houses, and then one die has the signs of the zodiac, and then you have the planets on the other one. So you can roll the dice and kind of roll the dice and answer different open-ended questions. So it can be a fun way to learn astrology for people, and typically it's a really good learning tool, but it's also been a really great addition into my sessions with people. So I do a lot of that. I do some tea leaf reading too, but it's primarily tarot and it's astro dice. A little bit of tea leaf reading. Tea leaf reading is very similar to Reiki in that if you're having a Reiki session and your eyes are closed and you kind of have a little movie play out or a little bit of an interpretive imagery that might happen, it's like that. You're kind of just like staring into the cup. There's different symbols. That's not really there's different symbols you can look at with tea leaf reading, but I follow more so the interpretive method, which is very similar to Reiki. You're just sort of interpreting and feeling, and it gives you an idea of what that person might be going through. So yeah, it's all a tool to gain more insight into a person. And yeah, I've been doing astrology for a long time and I really enjoy it. And it's one of the many, many hats. Yeah.
Yeah, I love astrology. Like I dove into it a bit and studied it, and I just felt like it was like a roadmap for my life, like just in front of me, like and understanding like my moon sign, that was like mind blowing. So I'm an Aries moon, so it's just like I have like a lot of anger moving through me, and I never really understood why, and just kind of learning all about that. It's really beneficial to find out like your first 3, and just like study those hard and figure out what they are. I find that is like so helpful.
Yeah, it's just another way to explore yourself and to ask questions. I mean, you don't have to adopt all of the points as truth, right? But it can be really intriguing, and it just helps you work within your own blueprint. You're right, and to get to understand what might make you tick. Yeah. What's your sun sign? So you're an Aries moon.
Taurus sun and Virgo rising. Okay.
That's an interesting mashup.
Yeah.
Yeah. because Taurus likes to go slow, but Aries likes to move fast. And then
Yeah.
you're gonna, and when people first see you, they're gonna interpret you as a Virgo.
Yeah.
So that's kind of the mask that you wear and what you show to the world. But yeah, that's an interesting combination of the three.
It's a lot is like starting and stopping, like going full force and then just stopping and then nothing happening. So that's been like my whole life. But
Taurus has great follow through, which is good. This is the positive I'm going to share with the three of these.
Oh, I love it.
Taurus has great follow through. Aries is great at starting things. So you might be able to start a project and have like good follow through. And then Virgo is great at ending things. So you kind of have the trifecta there. So,
that's right.
But out of the three, you're going to have the hardest time letting go and changing things. But you'll have great follow through and good startup. So that's, I mean, as long as you don't get yourself in toxic situations where you need to leave, you're good, right?
That's right.
Yeah.
Yes. That's awesome. Thanks for that.
Yeah.
Yeah, that's super neat. I had actually a question, Amanda, about the tea, about reading tea leaves. Does it matter what kind of tea, or is there like teas you can pick from and that kind of says something too?
It doesn't so much, at least to me, it doesn't matter so much what kind of tea you're using. Any kind of black tea, like as long as it's not the finely ground tea, like you're actually, getting more of a bulk tea look.
Right.
You're going to get more imagery through that. There's some herbal tea that can be really good. There's one, it's just slipping my mind as to what it's called. Fireweed. That's what it is.
Mm-hmm.
I was like, fireflower? That's not right. Fireweed. Fireweed is really fun to work with, and it's abundant in Saskatchewan. So if you can get some and dry some, and you take the flowers and you, you can have a great, it's a mild tea, but they make really pretty tea leaf reading. Yeah. So fireweed is great.
That's really neat.
Yeah, I've always wanted to have my tea leaves read. I've never done it before.
Yeah,
it's cool. I've been connecting a lot with the plants around my property and just like learning like what's growing here and like learning the different aspects of it. It's been like something I didn't think I'd enjoy, but I really do enjoy it. It's kind of lit something up with inside of me. And you're a herbalist. So what is one thing that you would recommend to our community that we don't get enough of here to really live a healthy life?
I mean, that's not a herb that I'd recommend. People need more rest.
Yeah.
People need more actual legitimate decompression and rest. And I say the same thing when clients come through. I'm like, there are some herbs that are really effective and they can help a person's body, but it would actually be better if you just, took an hour to rest every day. So my answer for that is it's not a herb, it's rest. And
that's so good.
An activity that's actually decompressing, where you feel at the end of it that you're at ease and calm and in that restful state.
Right.
And we just aren't wired to be that way. We're wired to stay busy, either mentally or physically, and wired to feel ashamed for any time we actually take downtime. So it's not easy to rest. It is something that gets easier with practice, but it's if you want to feel motivated about anything and you're looking to have a healthy lifestyle, it's finding adequate rest.
Yeah.
In my opinion.
I agree. Just getting like that nervous system calmed down. I went through something in the summer and it's just like when I was forced to rest, it was so uncomfortable. Like I was like, I didn't know what to do, but in the end of it, like my nervous system is at a completely different point and it just really changes your whole world, really.
Absolutely. And that's another red flag for me And even if it's in myself, and I have been that person before, if you feel like resting is really difficult, you need more practice at it. That's such an essential, it's such an essential thing. And again, we've just been such busy bees for so long, for so many generations, that we've just really lost that. And it's caused a breakdown in our health and our mental wellness. So if you can get good at resting, like really good at being, quote unquote lazy, if you can do it, that's amazing. I had to have it reframed in my mind because I always felt like one of my favorite things to do was just to like lie in bed and just like be alone and away from everybody. It's such a comfortable bed. It's amazing. And in my head, I'm like, I'm being lazy. I can't do that so much with a little one anymore. But like before a little one, I would beat myself up about it being lazy. But really, I work hard. I work really hard, and that's really valuable time. Like I deserve that time, and that's all I want to do. Just let me be in bed by myself. Bye bye, bye bye world.
Yeah.
Oh, yes.
It's restorative.
Yeah. And it's funny. They say like the person who doesn't have 2 minutes to meditate is the person who needs to meditate the most, like meditate for 10 or 30 minutes. And it's the same thing with resting.
Mm-hmm.
Like that is such a good message.
Mm-hmm. Yeah, I think it's really essential. And like even with my diagnosis when I was just out of high school, it forced me to find a different lifestyle. Like right before I got sick, I was studying, part-time at that time, but I was working full-time. And then I had a friend from Quebec who came and lived with me in Calgary because she wanted to study her profession, but in an English stream. So she wanted to practice her second language. And so she had asked me to also work at the Calgary Stampede with her, so that she'd have a friend. So I had to work full time. I worked from like 6 a.m. till 2. And then I was at the Calgary Stampede from 3 till midnight, and then rinse and repeat for 10 days straight. And of course, like I ended up with, a goiter and full blown like issue because my family I didn't have good role models when it came to living a restful life. Like both my parents were very busy. So it's just all I knew. And they also just kept me busy all the time. I was in back-to-back extracurricular activities constantly, and then studying late at night, and who needs to sleep, So it was a slap in the face. And I moved to Quebec and I did nothing for 6 months. And it was the best thing I could have done. It's hard to do nothing for 6 months, but you get the hang of it. You just need to get through those first couple of weeks. Yeah. Don't have to be productive all the time. But yeah, it can help people to just stop doing anything for a while.
Yeah. Do nothing.
Well, we put so much pressure on ourselves, and I don't think social media has helped that either.
No.
I think people feel even more pressure to perform, and so yeah, we're living in a world where it's not slowing down. The pandemic was interesting though. Those couple months of lockdown for Saskatchewan, it did feel like the rat race slowed down a little bit.
It did.
And then we found ways to try and be even more productive somehow. But it did feel like a slowdown, and it was such an interesting energetic shift. But I don't think we'll ever see that again. Or if we do, not for a long time.
Yeah.
But I have some favorite herbs. Like I have adaptogenic herbs. So when you're looking at adaptogenic herbs, the 3 most well-researched are going to be rhodiola, ashwagandha, and ginseng. So adaptogenic herbs help your body adapt to stress. So it's typically something you take in the daytime to help your body adapt to stress better, so that by nightfall, your stress hormones aren't so high that they're impacting your sleep cycle. So it is a sleep aid, but it's not something you're taking before bed. So any way we can help to regulate those stress hormones throughout the day so that your body's not dealing with them so much at nighttime, is really effective. I also find the use of medicinal mushrooms, so that's like turkey tail or chaga or reishi, have a really strong, amazing impacts for immune function and energy. They can also be very adaptogenic as well. So those would be my go-tos if I was going to be picking any favorites. But yeah, I mean, the herbal world is very intriguing. There are some herbs that are very well researched, and then there are some that aren't. They're more traditional uses that people are going off of. But again, I'm hoping that we can still have a lot of access to these amazing herbs with good research going forward.
Yeah.
Otherwise, we're all going to have to just learn to identify them in the wild and pick them ourselves.
Yeah, really. Take it upon ourselves. Yeah.
And it's so, like, I've been working with a herbalist for the past year because I was just kind of, researching myself and just kind of like find, oh, this is good for this, this, and this. But it was just like actually connecting with someone that fully understands the plants. It was like a big pivotal moment in my healing. So yeah, I definitely love herbalism. And I've learned so much from her. Like I'll message her like, hey, what's this mushroom? Hey, what's this plant? And just like learning all of it has just been so cool. And even the one side that I didn't even really know was like connecting with like the spirit of the plant. I connected with like the spirit of the mugwort plant, and it was just had crazy dreams, and it was like a super wild experience. So I was wondering if you've like ever tapped into like the spiritual side of a plant.
I mean, every plant is going to have a different vibration, which is really part of its medicinal benefits. So yes, I have. I've felt different emotions with different plants, but my greater interpretation of that is that everybody, humans alike, or even animals or plants, we all have this energy that we're bringing, and it can be very medicinal for people. So like me coming to a specific practitioner is like getting a specific type of medicine, just like it is coming to a plant. If you're approaching it with honor and, wanting to connect to that plant, you absolutely will. If you're just taking it because, you're not even thinking about it, you're not going to feel much, about that connection with the plant. You might get effects, but you're not going to be having a communication with that plant so much. But yeah, I have made, my own herbal products before. And I do like to sit with the plants and just feel them and ask, like, what is the medicinal benefit that's coming forward? Not just not just what's evidence-based, but like, what else emotionally, vibrationally can this plant maybe do for me? But yeah, it's a real thing. But I think humans have that same effect on each other. In a lot of ways. You can have a human that's that can be a bit of a poison to your system, or you can have a human around that's medicinal. So I don't think it's just plant medicine that that applies to. So yeah, I hope that answers your question.
Yeah, no, it does. And it just like reassures like that mind, body, spirit connection. Like if you like connect all those dots with the plant, I feel like that is like where the true healing lies. Like, well, it has for me. Like just like she'd make a tincture for me and I'd be like, hey, I want to know exactly what's in it. Cause I want to like, just kind of learn about each plant and then understand what is it doing for me. And yeah, it's been a really cool experience. I've really enjoyed it.
Yeah. It's a really fun world to explore.
Yeah, it really is.
I gotta get some more ginseng. I feel like that's something that's like pretty widely known, but I kind of forget about it. Especially with the help of like de-stress. That's such a good one. I'm putting that on my list.
Okay. Good idea.
Yeah. Okay. Well, we're kind of running good for time here. So Amanda's actually going to treat us with our card pull, or not really card pull today. She's going to do Astral dice.
Well, I'll do a card pull too.
Oh, okay. Yeah, she's going to do one for the readers. So we kind of narrowed it down a little bit to kind of help with the reading. And we set the question as, what can our readers do to help improve or exceed their gifts that they're working on at the moment?
I have it worded differently here. I can't remember the way you worded it, but I put, if anyone is having trouble tapping into their gifts, what insight would be useful?
Ooh, yes, that's what we're doing.
Close, right? Okay.
I couldn't remember how I worded it either. That sounded good.
That's why I wrote it down. Yeah. Okay, so I pulled 3 cards. There's a transformation card, a patience card, and a politics card. If I could show you what they look like, but essentially it's talking about how gifts are ever evolving. And so you're transforming along with your gifts, and that patience is a big part of what allows those gifts to come through and to grow. Being patient with yourself, being patient with the process and with the development of those gifts, not to rush it. And that, some people might try to shake your confidence, but to trust that you're moving in the right direction. And with the dice, I pulled Neptune and Libra in the 5th house. The 5th house is the ruler of the heart too, and having fun. So a lot of it is about exploring that spiritual side, finding balance within it, and having fun while you're doing it, not taking yourself too seriously. I think that's part of the problem for a lot of people, is taking it really seriously when life is just a constant journey of evolution, and we should give into that and try to have fun with it, as opposed to trying to be a certain image in our head or for it to look a certain way. So have fun, be patient, let the transformation happen. If people try to shake you off your path, just try to reconnect to your heart and be patient with yourself in the process.
Beautiful. That really resonates a lot.
Yeah, me too. I love that message. The patience, that's a big one for me.
Yeah. And what do you think it should look like, Sometimes I even get caught up with like, well, maybe I should be wearing like see-through cotton white robe. And it's like, that's not who I am. Like, come on. Like, but like, what is the image that I should look like? Well, it's not that, unfortunately, but it's my own,
Everybody has their own unique forward, and just let that come out, in my opinion.
Oh, yeah, that's where like the true authenticity is, and that's how you're going to attract the right people your way too, if you're being who you really are.
Exactly.
Okay, so if anyone wants to connect with you, where can people find you?
So if you're in Saskatoon and you're wanting to book in for therapies, my website is balancingelements.ca. If people are, looking for placenta encapsulation, I have saskatoonplacenta.ca, and I do service all of Saskatchewan. And then if people are looking for more of the astrology, life insight side, my website is amandala.ca. So I have a few different, I have a 4th website actually too, but I won't go into that one. And I wear too many hats. I had to separate everything, and you get a different version of me, I guess, depending on even with placenta, depending on the package you choose, like you might not even see me, that it's like a pickup drop off sort of scenario, or like with Amanda, it's we actually get to meet and have some sessions together and connect in a different way. So I do different things with my balancing elements. I provide primarily reflexology, but then I do have 2-hour sessions that change with the seasons. That are very well received. So right now I have the autumn package, which combines various essential oils, a hand massage, a back massage with hot stones, aromatherapy, peppermint oil on the calves, hot stone on the calves. And We do a scalp massage, face massage, and then we end with reflexology and Reiki. So it's a really nice 2-hour package. It's a very balanced one. And it's it changes every season, but I think the autumn one is one of my favorites. And yeah, it's very popular. So I have that. And then I am teaching a self-reflexology class in November. That's going to be out of the Albert Community Center. So it is in person. And that's an afternoon, a Saturday afternoon. So if people are interested in learning reflexology and how to apply it on themselves, that's great. And then, yeah, with my mandala astrology, I do birth charts either in person or online. And then I do Astral Tarot and a bit of tea leaf reading for people. So if people are interested in that, that's also an option. And yeah, I think that's all I have going on right now. The rest of my time is just with a toddler,
So busy. That's so busy.
It's so busy.
Oh my gosh, that's amazing. Well, it's been such an honor for us to have you. This was such a good episode. I can't wait for everyone to hear it and absorb all the knowledge that you shared with us today.
Looking forward to hearing it.
1, 2,